Hello there, people of the internet. My name is Jagero, and this is Dialogues with Jagero. Today, I am in the studio with our favorite health guest, and that is Okwisa Okwayo. So, today we are going to be talking about what is called polycystic ovarian syndrome, better known as PCOS. It's one of the most common hormonal disorders affecting women of reproductive age. Yet, it's also one of the least understood. That's what you told me. PCOS doesn't just mean irregular periods. It can bring a whole set of challenges. Infertility struggles, weight gain that's hard to fight. Acne, you said, that refuses to go away, excess hair growth, and even serious risk like insulin resistance to diabetes. Beyond the medical side, PCOS carries emotional and social weight, affecting confidence, relationship, and life choices, including whether or not to freeze eggs or delay having children. That's what you told me. Today, we are joined by Okwisa Okwayo, as I have already said, who is going to break it down for us. What PCOS really is, why it matters, and what options women have to manage it and take back control of their reproductive health. So thank you very much for coming, Okwisa Okwayo. How are you doing?
I'm very well, Jagero. How are you?
I can be better. I've been having a bit of problem with my feet for the last 1 month. You know, we went to soccer at the stadium and we walked a lot with Odiambo. And at some point I was feeling like, oh my God, it was very tough. So I always have this problem called plantar fasciitis, for which has troubled me for about 15 years. So that's probably why I'm also very keen on issues of health.
Okay.
You know? Yeah, so that's why I'm doing. I took very strong it's called muscle relaxer. Yeah.
Muscle relaxant.
Muscle relaxant. That's what it's called. Yes, a relaxant.
Like something with MR, like clozoxazone, aceclofenac, and paracetamol combination.
So that's what I am on. When you are on that thing, you're a bit drowsy, but you feel like you're floating.
Yeah.
That's the feeling that it gives you. So that is a long way of saying how I am.
And then you took that and also took coffee.
I took that and coffee and very nice chicken.
Double whammy.
So, how does this affect a woman's body? Probably you could also give us a little bit of history of it, right?
The history of PCOS? I don't know if I can package history per se, but maybe I can talk about why it's hardly diagnosed and why it's so hard to actually know that you're suffering from PCOS as a woman. So PCOS, as you rightly mentioned, is polycystic ovarian syndrome. So that basically means you have multiple cysts around your ovary, the organ. If you went to biology class, which most of us did, we studied the reproductive system. So every woman has ovaries. So for women who have PCOS, there's a lot of cysts around the ovary. And what are cysts? What are these cysts? They are immature follicles that are produced in their multiple sizes, and then they cover the outside of the ovary. So that makes you have a polycystic syndrome. Why do we call it a syndrome? We call it a syndrome because it is so hard to pin down. It has a myriad of symptoms. And it's also so hard to identify a single cause, because most women either have it because it's a genetic predisposition. Your grandmother had it, your aunties had it, and then it runs in the family. And some women then grow into it because of lifestyle and hormonal dysfunctions. Yes.
There is a lady that was telling me the other day that she had an operation and they had to remove 24 cysts.
Around the ovaries?
Yeah.
Yeah, that's a very good intervention. And we will get into that when we start talking about interventions. How do you then solve the problem? So first of all, I want to focus on how do you diagnose the problem and at what stage. So there are, like I said, there are a myriad of symptoms, but there are three predominant symptoms that if you have any two of these three, then you typically have PCOS. And you have to be very keen because PCOS affects 10% of the world's population.
10% of the women's world population.
Yes, female. I almost said 800 million people. Yeah, you're right.
Yeah.
10% of anyone who has an ovary. So
Okay.
out of 10 women, one of them highly likely will have PCOS. Now, the interesting statistics recently are showing that amongst black women, right, it's higher. So it could be between 20 to 30% of black women. So then that's why we have to be very keen in Africa.
Why is it higher in black women? What is the biological reason why it is higher in African women?
So it's not very well known. We are still studying. It's as researchers, this is a very big headache for us because we are still trying to discover what are the similarities and what is it that we have that makes us disproportionately higher affected with it. And also the symptoms in black women are more adverse. So you find like they present very harshly amongst the black population. So out of 5 women you see with melanin, 80% melanin, at least 2 of them will have PCOS. And some of them, actually out of the black population, 70% do not know they have it. So that's why their symptoms are harsher because they don't start to manage them very early. Yes.
Well, I mean, I'm just looking at the ovary. What is an ovary? An ovary is where the child is supposed to be nested in the womb.
No. The child is nested in the uterus. The child is incubated in the uterus. The ovary is the organ that produces the egg.
Okay.
And today, like I've listened to so many of your followers' feedback. They really want an oversimplification of facts and like to digest the science in a simpler way.
So there is this thing that looks like the cross. You know it?
That's the female reproductive organ.
And where is the ovary?
The ovaries are at the further ends.
There are 2. The one the fruits on.
Yes. The ones that look like the fruits. In fact, today I asked if you had a whiteboard, I would have drawn.
Okay.
Yes. So this ovary is responsible for producing the follicles, which then makes a woman ovulate. And when you're ovulating is when now you can get pregnant. But for a woman who has PCOS, they don't ovulate. That's why they end up having irregular period. They don't ovulate regularly.
The women that do not have that are suffering from PCOS,
yes,
do not ovulate
regularly. Yes.
And why is this? Why is it so?
Because now we have a gland in the brain called the pituitary gland.
Okay.
This pituitary gland is the one that releases a hormone called FSH, follicle stimulating hormone. So it's the one that's supposed to send a message to the ovary to produce the ova. Right?
To produce the ova.
The ovum. Ova is plural.
Yes.
I said ova, but it's ovum.
Ovum. Yes. Okay, so it produces the ovum. And yes. what is supposed to happen to the ovum?
It then makes you pregnant, yeah? Or then if you don't get pregnant, you have menstruation. You ovulate. Then if you ovulate after that, then you have menstruation. So for polycystic ovarian syndrome women, they don't normally ovulate regularly, so sometimes they miss their periods. Because if the ovum is not released, then the ovary does not produce progesterone, which helps you shed your uterine wall lining. That now is the period. Yes, so for these women with PCOS, they miss their period. So it's not something, yes, I know most women who miss periods, they think, okay, my hormones are not balanced, I'm missing my period. It should be a point of concern. Immediately you miss your period, please get screened because it could be presenting us. It could be masking or it could be PCOS. So if you're not pregnant and you're missing your periods, you should be checked. Number 2, and that's why as Chronic Disease Society, we are really increasing the vigilance in high schools where you find young girls who miss their period window. You see, instead of them getting period between the ages of 9 and 13, they're getting periods at 16, 17, 15. That's already an early sign that they have PCOS. And that one leads to aggressive infertility and many other insulin resistance and diabetes and other chronic illnesses. So to improve the diagnosis amongst women, we have to check early. Any woman missing her periods when they are not sexually active or when they are not pregnant, that's a point of concern, number one. Number two, you present with hyperandrogenism. So meaning you're producing more male hormones, the androgen hormone. So then that causes you to have male alopecia, that is the hair loss around this area. Alopecia is hair loss. Then you have a lot of hirsutism, that is a lot of facial hair. Like those women who you see who have facial hair, we call it moustache or chin hair. Yes, they have PCOS. Then they also have a lot of acne. Persistent acne that presents along your jawline that does not go away, you highly likely have PCOS. So those are some of the symptoms. Another symptom would be insulin resistance, but that one is so hard, it's not visible. So it presents as weight gain or metabolic dysfunction, where you find you're craving a lot of food, you are binge eating, or you are highly irritable. Then you can also end up having anxiety or depression. That's another symptom of PCOS.
The other symptom that I want to understand is the one for hair loss. Yeah?
Yes.
And because I think that we should explain it properly, and the reason why the women do not have start growing hair, maybe you said that there is acne along the jawline.
Yes.
And then you said that there's hair
facial hair.
Facial hair.
That is not needed in women. Should not have facial hair.
I wonder why though.
Because facial hair is stimulated by male hormones. So then if you're presenting with higher testosterone hormone, then your body starts being stimulated and you have male features. And they're a bit subtle, and then they become aggressive the more you don't manage the PCOS.
Because that is very interesting, because my sister had so you don't call them a beard though?
No.
What do you call them?
Facial hair. Okay, growing up.
But even eyelashes are facial hair.
No. So facial hair around your mouth, around your chin, around your jaws. I don't know. You know, women shave these hairs, so you might not be able to see. Some wax, some even remove using laser. So you may not be able to notice it visibly, but they have it. And women, I know you know what I'm talking about. Yes.
They hid them there.
Yes. So growing up, I used to see these aunties to my father having a lot of facial hair, and I thought it was weird. Little did I know it was PCOS. So as I said, it runs in my family. Because my sister
had a problem with fertility, and she had facial hair.
Yes, so she had PCOS. Maybe went undiagnosed, or it had late diagnosis. You find
so there is a hormone that you said is being produced, so which results into having facial hair. Which hormone is it?
Testosterone. So I said one of the symptoms of PCOS is hyperandrogenism. Meaning, because you are having uncontrolled estrogen. Can I go into that?
Yes.
So the pituitary gland releases FSH, which causes you to ovulate.
What is FSH?
Follicle stimulating hormone.
Okay.
So normally for PCOS people, the FSH is not sufficient. So they keep producing the ova, but it becomes a follicle just filled with fluid, which is cystic. Then it surrounds the ovary. It never ovulates. It doesn't come from the ovary to the womb so that you can shed it through ovulation. So they have what you call anovulation. So these particular women then end up receiving, or rather having, disproportionate amount of estrogen. So the estrogen is uncontrolled. Remember, estrogen is supposed to be also balanced with progesterone hormone in women. So because you are not ovulating, the ovary is not getting signals to produce progesterone, which then makes you have a period. So then you end up having, and the cysts around the ovary cause you to have more androgen hormones, which produce testosterone hormone, which is more of a male hormone. Then this male hormone causes you to have these male features. And then if you're not having male features, sometimes you have a lot of acne. And it's not, you see, most women who have acne, cystic acne or uncontrolled acne, they do everything about it, but since it's hormonal, it's so hard for it to go away. So it becomes what we call chronic acne.
And this is why the snail mucin cannot remove it.
It is and cure for acne is mostly niacinamide and something that controls the sebum. So snail mucin is more of moisturizing.
Okay.
Yes.
Can you tell me about that? What did you say is going to take care of the acne?
Niacinamide.
What is that?
It's an agent that attacks or rather controls the sebodiarrhea. So the production of sebum, which is then fed on by the P. acnes bacteria that causes the acne. And acne is always within the hair follicle.
I think you need to contextualize acne properly.
Yes.
I think that you've jumped ahead of us. Can we talk a little bit about acne properly?
Okay.
Yes.
Acne is a bacteria. It's called P. acnes. The P is a long word. I can't pronounce well. So the P. acnes bacteria feeds on something the skin naturally produces, which is called sebum, right? So this sebum is always behind a hair follicle. Are we together?
Yes.
So remember, I already said women who have PCOS have hyperandrogenism. So meaning they're producing a little bit more hair than the normal woman. So within those hair follicles, the hair does not burst out nicely, and then the sebum plus the hair produce enough food for this P. acnes bacteria, which naturally exists on our skin. So then when that bacteria causes the lesions within the pores, it becomes acne. That thing you visibly see. Now, for control of acne, you can work on the P. acnes bacteria or you can work on the sebum.
Okay,
so that's why
there are two things here that is causing acne.
Yeah.
So there is the sebum. What is the work of sebum?
Sebum is what makes our skin succulent and supple.
Succulent and supple means looking good.
Yes, and looking young. And sebum plus hyaluronic acid makes us look young.
Okay.
So anyone who has sebum is a good thing.
Okay.
Yeah.
And then we have the P what?
P. acnes bacteria.
Bacteria.
Yes.
Which is also living under our skin.
Yeah, remember, on our skin we have a lot of microflora.
Okay. What is microflora?
Yes. The bacteria, the good organism.
Okay.
Yes, that keep us alive. So well balanced, your skin is okay. But now when then it gets a lot of food and feeds on the sebum and you're not well controlled, you're going to have a breakout. Okay. But now with women who have hormonal dysregulation and they're producing a lot of hair follicles and a lot of hair, then they are disadvantaged. Whatever they do, the acne keeps overpowering because they have a lot of food for it. Then they present with acne.
Okay.
So even if they keep doing this good cosmetic work, the acne is more aggressive. So it proliferates faster than they are able to treat.
So then how do you make sure that you have a problem, a chronic acne? You can decide to go for screening and you will be given the bad news. That I think sometimes bad news, sometimes good news, because the good news is that you now know what is harming your body.
PCOS,
and yes, and you should be able to treat it. The bad news is that you have PCOS.
Yes.
All right. But then, how now do you deal with if you are not dealing with the? Is there sometimes do you have people who do not have PCOS, but they still have a problem with lots of sebum and lots of this bacteria that is feeding on this sebum?
Yes, but very highly unlikely. Very few. So the larger, remember PCOS is the tip of an iceberg. You know the way the iceberg, you only see the tip, and then the rest is submerged in water. That's PCOS. You'll only see a tiny weeny symptom. But the real problem is PCOS, yeah? So when there's acne, highly likely, underlying that acne is a hormonal dysregulation or a profile. PCOS is a profile, a myriad of symptoms coming together that now cause those issues in the body. Because remember, I told you also, acne is a sign of liver failure, or rather liver fat, right? So liver fat is also caused by metabolic dysfunction, which is caused by PCOS. So, and you know, PCOS occurs as women grow older, the chances of having it increases.
Okay. We were on numbers. You started number 1, number 2, number 3. You remember where we are now?
I was talking about the symptoms of,
yes.
like if you have any 3 of these symptoms, then you have PCOS.
So we talked about acne. We talked about irregular periods.
The first one was cysts around your ovary.
Yes.
Visibly. Those ones can be diagnosed through an ultrasound.
Yeah, but you can't see them, right?
You can't see them. So those ones now, for confirmation, like for me, let me not talk about my personal story, but I actually have PCOS.
Why don't you talk about your story? Because that is. Do you want to talk about your story?
Yes, I can talk about my story. Yes. The reason why I became passionate about chronic diseases, I told you, growing up, my dad's aunties used to have facial hair. Okay. It was very funny, and they were made fun of. They were nicknamed in the village, they have facial hairs, so it was a funny thing. But little did I know, as I grew up, that means it's a genetic disorder that's within the family. So I would see some of my relatives have diabetes, some have cardiovascular conditions. So it's all related, the female side, yeah? So now, and maybe some of just the symptom profile. So as I grew up, I didn't know it will in any way affect me. So I got my first baby. So I got pregnant. Then during the surgery, it was an emergency surgery. I was half anesthetic, the half one. So
half what?
When you're doing the surgery, you can choose full or half. Where half you are semi-conscious, like you can be alive in the room. So I had the doctor saying, the OBGYN was doing the surgery. He was telling the team, hey, this lady has a lot of cysts around her ovaries. How did she even get pregnant?
Did you know what cysts were at that point?
Honestly, I was too young to even know. I was not that much deep into the science of it. So I was like, what is that? Like, am I dying? I didn't understand. So the baby was safe. I delivered safely. But then the doctor closed me. He was like, do I remove them? Do I not remove them? And closed me up. But I could not contribute to the answer because I was under.
He should have removed them.
I wish.
Why was he choosing not to remove them?
Because of consent.
Do you have to consent for your cyst to be removed?
Honestly, I'm assuming that was the reason. Because in case anything goes wrong.
Why do I feel like it was supposed to be another charge?
No. I think it was
we right now that what has been charged is removing the baby safely. We need to charge for the removal of cysts, because that's how doctors go home smiling.
That could be one way. Another way could be maybe he needed my consent in case anything went wrong during that separate operation. Then I could have claimed legally that I did not consent to it. So it could have put him in legal trouble.
Oh, I see.
Yes, that's
or the whole chain of a health operation has not taken place.
Yes,
we are here to remove to safely
remove
get the baby. Yeah, but then,
and remember, it was an emergency, meaning it was not a prepared surgery. So already the odds were against me.
Okay, great.
So now, when he said, I have cysts around my ovary, multiple cysts, I didn't read too much into it. And he said I was lucky to even get pregnant. Lucky. Meaning, the amount of cysts that were around my ovaries, I was not supposed to even ovulate. So then I came out of that operation room and I started digesting this and reading about this condition and talking to the doctor about it. And then I realized, wow, I was actually indeed lucky. Yeah, because most women, even some in my family who have this particular condition, have trouble conceiving. That's why I told you about the infertility issue. Yeah, I have experience with women who, yes, you get pregnant, you get married, you do the whole thing where you get education, get a nice job, delay marriage and babies. So now for a woman with PCOS, you have higher chances when you are younger. Remember, women are born with all their eggs. So as you age, your eggs also, the production ages. So that's why most people go into silent ovaries. Some hit early perimenopause and menopause because also our lifestyle is not allowing us to have optimum health. Yes, so now you are even more disadvantaged if you have PCOS. So these particular women in my family who have PCOS, there's one in particular who now got married and wanted to have children. And she was, maybe significantly older than me. So she couldn't. And I'm talking older than me, like not even the age of 34, still below the age of 34. And she did everything. She went to South Africa, Nigeria, everywhere. Now she ended up in India, where they had to now diagnose her properly and tell her your ovaries have failed, they're silent. So the cysts have really...
Your ovaries have failed?
They're silent. Yes. The cysts have really created a fence around them. They cannot release any egg. Yeah? So the eggs are there, but they're not maturing. The cysts are just immature eggs that now surround the ovary. So like the ovary is in prison. Yes. So that already presents with so many multiple syndromes, or rather, symptoms. So now she cannot produce. And you know when you're not producing the egg, you're not ovulating, so meaning you're not also menstruating. So the irregular period means you can go 3 or 4, 5, even 6 months without seeing your period. And remember, this time you're married, now you're ready for a child. And now they told her, if you do not freeze your eggs before the age of 34, you may never have a child. And remember, this notwithstanding lifestyle adjustments and dietary intervention, which I'll talk about. Yes.
Okay. We were going ahead and talking about a few things. You remember what the things that we were talking about?
Yes, the 3 symptoms to know for sure you have PCOS. Number 1, hyperandrogenism, which presents as acne, hair loss, weight gain, hair in the face. Then we have cysts around the ovary, which can be diagnosed through ultrasound, and then irregular periods. These 3 for sure. If you have these 3, you have PCOS. If you have any 2, you have PCOS. And it's not good to delay diagnosis or to argue with your symptoms too much. It's okay to be diagnosed early and get to seek interventions earlier, because then you can reverse it, possibly if you're disciplined. Yeah.
And how does it... when I was reading about it, I also saw that there is an issue of weight gain.
Yes, now that's also in the hyperandrogenism, which now leads to also insulin resistance. Remember, insulin is a hormone, is a peptide or a hormone in that profile, meaning the way the body regulates itself, you have to be optimally performing or normal for your insulin to be okay. But for women with PCOS, you have insulin resistance because your insulin is not... working on the glucose. So you have excess insulin in the bloodstream that is insensitive. Right? So your pancreas is on alert. It keeps on releasing the insulin, but insulin is not working on the glucose. So that gives you massive cravings and binge eating. When you're craving, massing cravings is when you have a compulsive nature to eat. It's compulsive like when you're pregnant. You know, when you're pregnant, you're highly hormonal. Remember, when you have PCOS, you're highly hormonal, disproportionately where you have uncontrolled estrogen, very low progesterone. So obviously you're imbalanced. So the cravings are not normal. So you are having compulsive eating, what we call disordered eating. You even find these women can wake up at night to take soda or to eat. So now this is what leads to weight gain.
Yeah. So the weight gain is not hormonal in the sense that the hormones are making you overweight or gain weight, but it is pushing you towards a lifestyle that is going to make sure that you've got a lot of weight added.
Yes. The hormonal disruption is what's making you uncontrollably craving food, so you binge eat. Then we have what we call weight cycling, where you gain, you lose, and then now your body, when an alarm rings for too long, you even stop understanding that it's there. So during that high alarm, where your hormones are just on a high, you stop becoming sensitive to that alert. Yes. So for women who have PCOS, it leads to hormonal disruption, high cortisol, depression, anxiety, now binge eating, and weight cycling. So it's not something they can control. But not all women who have PCOS are big or fat. Some are actually that's why they might miss it. Some are in normal bodies. Some are even skinny.
It is interesting that sometimes we look at somebody and they're struggling with weight, but we might judge them harshly and say that unapenda chakula sana, but it's just illness. Somebody just at the very fundamental level, they are ill,
Yeah.
and they're struggling with something.
Yes. It is food addiction. So you crave food. You crave food like how come you're very forgiving when a woman is visibly pregnant and eating, you're like, she's feeding the baby. But it's not the baby that's the issue. The baby actually doesn't need any food like that in that sense. It's the high hormone that's making her want to eat.
I want to go back to your personal story a little bit. So you've been sewn up. What is the word called? Sewn up or sewn up?
Sewn up.
Sewn up.
I know how to spell it, pronunciation, and neither here or there. So,
and then you hear the tea during the operation that they're saying that you've got a lot of cysts around your ovaries. When you wake up and you're feeling better, how do you start dealing with it? You go back to and start asking yourself, what is going on? What are cysts?
Yeah.
How do you start going through the phase of getting help with your cysts?
I even never thought I need help per se, because I didn't think it was such a bad thing. Because it's a cyst. They're not saying tumor. Remember the language they use is a cyst. So I thought it's just benign.
Did they write anything on the medical report that you need to go for further checkup?
Even if they did, I think I was too ignorant to understand that it was that impactful to my health. Yes. It's when now I went into medical research that I realized how much the polycystic ovarian syndrome is a bedrock of so many chronic diseases, including cancer, ovarian cancer and endometrial hyperplasia, which causes cancer.
Hyperplasia?
Meaning like when the uterine lining keeps thickening because you are not menstruating, right? Then eventually it could become malignant. Yes. And then the ovarian cancer, because remember, I told you the ovary is like in prison. It's under arrest.
Yeah.
It cannot even function properly. It's not producing the hormones it should be producing.
So you went to the hospital, and how did that go?
I didn't go to the hospital. I left the hospital with the baby.
Yeah, but you because you're saying that you suffered them, then how did you go back?
So then I was lucky because I was diagnosed. Remember, there's no cure for PCOS.
But there are cysts that can be removed surgically.
Yes, that's an intervention. It doesn't mean when they're removed, they stop producing more.
So you keep being on the lookout.
Yes. In fact, maybe I would like any woman who has gone through it, the surgery, they can tell us if they got significantly better, if they recurred. It's just like fibroids. Is it the way fibroids, even after surgery, they recur. That's why it's a syndrome. It's a chronic syndrome. It does not go away.
Yeah. There are several ways of dealing with it that you told me that we are going to deal with, correct?
Yeah, we are going to talk about the intervention. And the first intervention is, of course, dietary.
Okay.
But before I talk about dietary, let me talk about supplements. Because there's no particular medicine for PCOS. So that's why, as researchers, we are really frustrated with some of these conditions that heavily affect Black people, and they are not having proper research for cures and interventions. So they're affecting only women, and mostly they're affecting adversely Black women. So we are having trouble finding funding to improve the discovery of medicine or the intervention, because I know even if it's in 50 or 100 years, there'll be a cure for PCOS. But no one has put in the time and money yet right now to find a cure, because maybe most of the people who fund these researches are not affected by PCOS. Yes. Okay. It's just like the way in Africa we have a lot of sickle cell anemia. And sickle cell anemia has gone untreated, or the interventions have been very slow because it's affecting people who don't have the budgets for research.
So when you talk about diet, what exactly are we looking at? Is there particular foods that people that are suffering from this illness are supposed to take? What are the supplements?
So before I talk about food, let me talk about the supplements.
Okay.
There are 3 supplements that are holy grail, and they're good to maintain the symptoms or to manage the symptoms. Rather, sorry, not to maintain, to manage the symptoms. So the first one is called inositol. And sometimes it's myo-inositol in combination. So inositol will help you and increase your insulin sensitivity so that it reduces the insulin resistance. Then we have magnesium and vitamin D, D3. So these ones, they help reduce the alarm in your body where hormones are dysregulated, and then you have a lot of massive cravings. So, of course, the magnesium helps you sleep better. And it
Magnesium helps people sleep better?
Yes.
Why? How?
I don't know how, but it really reduces sleep apnea. Sleep
apnea. Lack of sleep is called sleep apnea.
Or even just continuous sleep where you sleep and wake up in the morning. You know, some people sleep every 2 hours, they keep waking up.
Yeah.
Yes. So magnesium helps, vitamin D3 and inositol. But the one that I find very interesting is omega-3.
Yeah, samaki.
Yes. I think we really advocated for it for the kids, and then when we grow up, we stop taking it. But I would really encourage...
I bought it somewhere in Europe, but it smells really bad.
Yeah, that's why it's put in capsules, so you just swallow, you don't have to drink it.
Yeah, mine is for drinking. It's really bad. It's very yucky.
But you eat omena.
Can you really?
Don't you eat fish? Don't you eat mackerel? Don't you eat salmon?
It doesn't. No. It doesn't smell like that. Have you gone to a beach where they gut fish? It's different from the fish you are eating. It's different. The fish that you're eating is not as...
No, okay, because you're talking about tilapia. You're talking about tilapia.
No,
but sea fish, it smells really bad.
But even mbota smells really bad. And it's lake fish.
Yeah.
Mbota really smells. Mbota has got one of the... It's a very smelly fish. But when it is cooked, it doesn't smell like that thing I'm drinking.
Are you drinking it now?
I am drinking. I keep drinking it.
It really helps.
Yeah, fuck it. Sorry. It's really bad.
But we don't have options. If you have PCOS, you must always have omega-3. Yeah, omega-3 is a massive antioxidant because we don't produce it.
What is omega? Can you explain to me what omega-3 is?
It's an oil that we do not produce. As human beings, we don't naturally, our bodies doesn't make omega-3. But you know what we eat? We eat a lot of omega-6 and 9s.
Where is omega-6 and 9?
Omega-6 and 9s are found in everything we eat. Cooking oil. And I think of 3 meals you eat in a day, 2 or 3 or all of them have cooking oil. Eggs are made with cooking oil if you don't boil. Your lunch is made with cooking oil, even if it's rice, even if it's beans. However simple your meal is, somehow it's cooked with cooking oil, whether fried or boiled, then refried. Yeah.
So that's omega-3, omega-6.
Yes, omega-6 and 9. So when omega-6 and 9 is pumped into your body at that high rate, then you risk having inflammation. And I think we talked about inflammation the first day I came here. So this pro-inflammatory diet must be countered. Otherwise, if you do not counter it, then it leads to chronic inflammation, which is chronic disease, like diabetes, hypertension, cardiovascular risks, that is the spectrum of CVRM, cardiovascular, renal, and metabolic, that's kidney failure, kidney disease, liver failure, hepatic dysfunction, cancer, diabetes, obesity.
So the question is, if we do not produce omega-3, then why does the body need it? To counter omega-6 and
because you keep eating omega-6 and 9. You keep eating.
So?
Yes, it's in your corn. And I'm so sure everyone in Kenya, or most people in Kenya, have a maize meal on their table before the day ends. Either githeri. Those who don't eat ugali, it's not like you should boast about it because you still eat corn, githeri.
So because we are taking excess of omega-6 and omega-9, then now we need to count it with omega-3.
Because they should be on a ratio of 1:1. And normally, we do eat omega-3 here and there, but it's not enough. It could be on a ratio of 1:20. So then you have a high inflammation.
I hope that you are enjoying that episode, people of the internet. You know, everybody says there is no job. And that is true. Also, that was me 10 years ago. The problem is that everybody is trying to get a job in their own town, in their own city, in their marketplace. They ask friends for jobs, mothers call uncles, uncles call fathers, but there are no jobs, right? Let me tell you what no one is telling you. Jobs migrated online. What I actually mean is there are many, many jobs around the world and there is no one to do them. I have worked for a long time online, I think more than 10 years. I work for Americans, I work for Europeans, I work for the Chinese, the Australian, Canadians, the Ugandans, name all of them. And last year, I had a eureka moment. I said to myself, you know what? I should compile what I have been doing for the last 15 years. So in 2024, I wrote a book called Gold Mine, 18 Side Hustles for Africans. And it sold a lot of copies. In fact, I was going for, sometimes I was receiving 500 orders in a day. In 2025, something happened. AI came. I think in 2025, AI came. AI came in 2024, but in 2025, it is here with us. And people say AI is taking away their jobs. And for me, I'll say false. There are actually AI jobs. Now, mimi ni nani? I created more jobs. We now have in my book 25 online and offline side hustles that you can do anywhere in the world, whether you are in the village, whether you are in your small town, whether you're in a marketplace, whether you are in your house, you can do them. In this powerful volume 2, I share 25 new actionable online hustles specifically researched and tailored for Africans. My new book provides clear step-by-step guidance, drawing from my extensive experience and research, including the mistakes I have made and lessons I have learned over 15 years in this online job market. You can become an executive assistant to busy folks in Europe, America, and Canada. You can also get paid for tasks like watching videos and taking online surveys. There are many of them and they're in my book. You can also build a business as a virtual assistant, start an e-commerce without a shilling. You can also become an affiliate marketer or an online English tutor. And you can also do tens of AI jobs, and they're all in these books. If you have a job, that is fine, but I know around you there are so many people that are always looking for jobs and at home watching Netflix. Buy this book for your brother, for your sister, for your mother, cousin, husband, who is back at home all day, all night watching Netflix. Okay? Buy it for your friend, that friend who is always asking you for cash, you can buy this book for them. All the information is in the description below. You can also inbox me, you can WhatsApp me, or you can go to my website, which is oduorjagero.co.ke. The book is only 1,000 Kenya shillings. Or if you're anywhere around the world, the book is $10. So thank you very much. Back to programming.
So for that simple reason, you should have omega-3 supplement. And even more so when you have PCOS. Yes.
Okay.
And PCOS can be developed. You might not have it, but you might develop it with time based on your diet, lifestyle, and just hormone dysregulation. Because you find even when women are going into menopause, their hormones start going down. The body's not producing the hormones it should. Yeah.
Okay. How about diet? You said you're going to
So
talk about diet.
Diet is very key, because now you have to be very careful about what you're eating. So you should eat things that are rich in low GI. So
Things that are low in?
You should eat carbohydrates, yes, but what we call complex carbohydrates that don't necessarily increase your glycemic index. So carbohydrates that make you stay.
Glycemic index?
Yes.
What
glycemic index is
what is it?
Blood glucose levels. Sometimes when you eat high glycemic foods like soda, it spikes. It gives you spikes. And when you have PCOS, you must be very sure that you're not having high spikes, because you already have insulin resistance. Yeah. So to control your insulin resistance, you must eat food that keep you satiated for so long. So foods like quinoa, oats. Yeah, quinoa is an ancient grain. Lentils, beans, obviously, and the whole category of legumes. They keep you satiated for long. So then you should choose these complex carbohydrates over simple carbohydrates. That's the first intervention. The second one, you should take things like turmeric and green tea and matcha. Matcha is like the powder form of green tea.
Yeah, we ate it yesterday, man. It doesn't... Especially if it is given to you using almond oil.
Almond
milk. I took it yesterday using almond milk at the Harvey Garden. Is it Harvey Garden or Harvey?
The matcha haven.
The matcha haven. Yeah.
It's not about the palate. You know, we are taking care of the palate, but we are forgetting the function, the cellular function of the body. We should not eat to feel good in the mouth. We should do functional eating.
I would say that is very important. You don't want to eat something that you are not, that is yucky.
But who defined yucky?
You can feel it.
No.
When somebody says yuck, it is him feeling the yuck.
Yucky is the signal you give yourself based on how you've been introduced to food. Like, let's say...
Okay.
You told me the other day that you don't like Chinese cuisine.
I do not like it at all.
Okay, have you ever had Nigerian fufu?
Yeah, but it's full of pili pili, my friend.
No, forget the stew, the swallow.
No, they put
the yam itself. Is it
the fufu? Oh, I was talking about jollof rice, which is full of pili pili.
Yeah.
The fufu is which one?
This yellow thing that...
The one that is slimy.
Yes. No. The slimy is okra.
Okay.
This yellow food. Okay, they are version of ugali.
Oh, yes.
It's really tasteless. The same way Nigerians find ugali very tasteless, but you find it yummy. So what is food? What is really the taste of food? It's the messages you tell yourself. I told you about neuroplasticity. We are whatever signals and messages we tell ourselves. So if you tell yourself matcha is yucky, then it will be yucky. The same way I find black coffee very yucky.
You hardly eat it.
But so many people like black coffee.
I love it a lot.
Yes. So you see, it's just the social, the way we've been exposed to it, and then how we now,
Because something that I almost call you Dietary. Something that I've always wondered, eating has to be enjoyable. So that's because when you go to the restaurant and you taste it, you are not, at that point, you're not taking care of your body.
That's called gastronomy.
What is that? What is
gastronomy? Gastronomy is like the art of food. Where we have chefs who do Michelin star. Like, why do we have a chef with a Michelin star or a sous chef or this kind of categories of chef based on how well they pair food, how well they, should I say, marinate food and cook food so that we enjoy it. But it's very subjective. That's why some people like sushi, some do not. Some people like, I don't know, do you know Russian food, Swedish food? We might not know. And when they come to Kenya, they might not like Kenyan cuisine. Some people don't like Italian food. So why? Why is that so much oscillating? Is there a universal food where we say, this food, no matter who eats it, is yummy? Maybe fruits, nature's own.
Yeah.
So apart from fruits, everything else is a construct of our mind and culture. Yes. So why then not choose to go with the constructs that are functional for your body type? Especially when you're a woman with PCOS, you don't have a choice. Then just choose to teach your body to love foods that are high in fiber, carbs that are low in glycemic index.
What is glycemic index?
the blood sugar levels. I think I've told you. You need a cup of coffee.
What?
You need a cup of coffee.
You told me again? You told me before?
Yeah.
No, but you keep repeating it. I don't know. I'm forgetting it.
Yes.
But there's water here which is very yuck.
You see what I tasteless. Yeah. So then they need, I talked about turmeric, talked about green tea, where I talked about matcha, and then they need things like berberine, berries.
Yeah.
Berries are very good for women with PCOS. That is the whole spectrum from acai berry, blueberry, strawberry, goji berries, the wild berries. Name all the berries they need. Whatever is in the berries, the polyphenols are very good for antioxidants. Remember, already someone with PCOS is pro-chronic inflammation. So already your body is inflammation, it has a high affinity for inflammation. So you are
prone.
pro chronic inflammation. So everything you should be eating should be anti-inflammatory. And I don't want to talk about yo-yo diets or these diet fads, but at least embrace the Mediterranean diet or Paleolithic.
What is Mediterranean diet?
From farm to plate. Less, in fact, if not at all, processed food. Yeah, a diet that is full of nuts and fruits and raw food and more greens. So anything that is white should not make it to your plate unless it's fish. Yes.
Okay.
Then Paleolithic diet is now the quinoas, the chia seeds, because these are ancient seeds that have been preserved. The ancient seeds like sorghum, millet, the seeds that have not gone through GMO, a lot of GMO. And the super foods. So those foods should make it to your plate. And you'll enjoy the taste eventually.
Yeah. So we talked about the diet, and then no, we don't start with the diet. There is something that we started
Supplements.
with. Supplements.
Inositol, magnesium, vitamin D3, and omega-3.
Okay.
At least have those four as a woman.
And then we
PCOS.
talked about the diet, which you have explained in detail.
Yes.
And then are we talking about freezing eggs?
Yes. Now, after the intervention, we have to talk about the symptom called infertility and how do you come around it. Yes, because I think that was the biggest pain point of PCOS, and the one that now makes the society pay attention is when now you cannot be able to have children. And you find some have the firstborn when they are younger, but they are not able to have the second and thirdborn because the PCOS gets more aggressive.
Can we dial back a little bit and tell the audience again why there is infertility within the category of women that are suffering from PCOS?
Yes. So as a woman of reproductive age, that is, I'm assuming the age of 21, because below 21 I think you will be too young and not government. That's child abuse. So between 21 and the age of 21 and 50. Yes, that's reproductive age. But nowadays it's decreasing to 21 and 35, unfortunately. It should be 21 and 50, but now it's between 21 and 35. That's the only window you have to get pregnant. And even between 21 and 35, right? Only 25% chance of getting pregnant every month. A woman only has 25% chance of getting pregnant every month. So already that 25%. Is below average. Yes, that's already below 25%. Average. Yes. So even if you're having regular, that word, you only have 25% chance of getting pregnant every month.
Why not? Why is the 75 going?
Because of ovulation. Remember the fertility window, even on the 21.
Are you talking about 25% for women that are suffering from PCOS?
For normal women. A woman who's normal, doesn't have hormonal issues, doesn't have anything. That's why when a woman gets married, she might even take 2 years, and she's normal. There's nothing wrong with her body. She might even take 2 years before conceiving a child. Because every month, her chances are only 25, if you're lucky and you're good with timing. Yes? So imagine with PCOS where you're not ovulating, then your chances reduce to maybe less than 5% every month. So it's not that they don't produce eggs, it's just that they don't produce eggs regularly.
Oh, I see.
Every month. And every month when you produce that one egg, you only have 4 days to get it fertile. Or to get it inseminated, I think that's the word.
So then let's talk about, so if because now marriage, if you want to have a child, let's not even talk about marriage, because then marriage is different from having a child.
Yes.
You can decide to have a child later on in life.
Yes.
But you don't want to have it between the age of 21 and 35. So that means that you want to freeze your eggs.
Yes. What
is the process of freezing an egg?
Okay. So IVF topic is very young. And the industry is growing. In fact, in Kenya, what I know of, and I'm very good in studies and science and research of knowing the latest interventions of disease and all this. So in Kenya, I only know of less than 10 IVF centers. And these less than 10 IVF centers, the patient queues and the patient load are through the roof.
Really?
Like if you go to visit one of the doctors somewhere in Upper Hill, I think they even have a queue of like 100 patients a day.
100
of women
patients.
who are going through fertility issues and they want to have an intervention. So these women have the options, and one of them is freezing eggs. Or rather, harvesting eggs, because you don't have to necessarily freeze them at once. You can harvest and do IUI.
What is IUI?
IUI is when you inseminate the sperm direct into the woman's womb.
Okay.
Yes. IVF is when you do it outside the woman's womb.
Outside?
Yes. Then you return the embryo into the womb.
Through surgery?
No. Through insemination as well. In vitro fertilization, IVF in full.
Ah, okay.
Yes. So what happens is when a woman has PCOS, they are not producing, they have immature follicles, like I mentioned. So these immature follicles are the ones that become cysts. So what happens when you go to an embryologist or a fertility doctor, they then give you these treatments that help your eggs mature, that you inject yourself around the ovaries so that they can stimulate, the follicle stimulating hormone can now do the whole entire process and help your eggs mature in terms of follicles growing to a size that is enough for ova or for the ovum to now then ovulate. So because you already have a hormonal distress, the ovulation, they try and do it artificially.
Yes.
So then they inject you, your follicles mature, and then they do it artificially by harvesting the eggs. Instead of waiting for the egg naturally to come to your womb, they remove it themselves. Then check for the viability of the egg. Then now inseminate it outside in a lab. Then once it's an embryo that's viable, they return it to your tummy to become a baby. So why am I encouraging women to freeze their eggs? Because nowadays, whether you have PCOS or not, fertility is dwindling. Fertility is dwindling. We are having a lot of early menopause. We are having a lot of silent ovaries. And I've seen so many women in their late 20s, early 30s being declared menopausal.
What happens when you are declared menopausal before menopausal age?
It's very unfortunate, but I've seen it. It means you cannot have children. So now it's no longer an issue of infertility. Actually, if you are infertile, it's easier because you can still harvest your eggs.
If you are infertile?
Yes. But now if you're declared menopausal, you cannot even harvest your eggs. You have to now get an egg donor. And this particular egg donor, of course, is anonymous. Then maybe can use the sperm of your husband and you make a baby.
The sperm of your husband?
Yes. Then it's your baby. You get an egg donor. As a woman, you're not able to produce your own eggs. And this,
where does it grow, the baby?
The baby can grow in a surrogate womb or your own womb.
Because
in as much as your ovaries are not functioning, your uterus may be functioning. And we have some women who have blocked fallopian tubes where their tubes are not functioning, but the egg is functioning and the uterus is functioning. So there are many reasons for infertility. But in our particular case of PCOS, it means your ovaries are not optimum in maturing the follicle. So then it's matured artificially, then it's harvested, and then the egg is either frozen. If you have a partner, the embryo is frozen. And then it's put in an embryo bank, which in Kenya we don't have enough. And I know maybe we have 2 or 3. So mostly we export these embryos to either South Africa or US or India. Then now the day you want to do insemination and get pregnant, these embryos are imported back to the country for you. Because you have also to, the viability of the embryo is in the safety of the lab. So they're exported in liquid nitrogen
They're
these other
dipped in
countries.
liquid nitrogen.
Yes, okay. Cryogenics. I don't know how to explain the science of exporting labs, but yeah, it's happening a lot. Medical tourism, where now your baby. I know of someone who harvested their eggs in Kenya, and the eggs are living in Miami in the US. When she'll be ready, she will import them back and get surrogacy.
Do you know there are warehouses where you can go and put your sofa sets and your glasses if your house is full?
Yes.
So that is so you were talking about such kind of a warehouse.
Yes, I'm talking about egg warehousing. In a bank, in a lab, an egg bank. Am I making sense?
You pay per month to have your sofa sets.
Yeah,
in
you
a
have to pay
warehouse.
rent for these eggs. You have to pay rent.
What is the- what
if you're storing them for 5 years, 10 years, let me tell you, and I encourage women to do this. If you have PCOS, harvest your eggs in your 20s, because as you get into your 30s, you might not be viable. Your eggs might never mature, or they might not be viable for harvesting, right? Because the cysts also interfere with the quality of eggs. So harvest your eggs in your late 20s. Early, if you don't have a partner, it's okay. But at least, because you might get a partner at 42, and at that time you want a baby, and your eggs are fried. It is not your wish. It's not that you want. It's nothing against you.
If I ship out my eggs at 25 to Miami, by the time I'm hitting 39, how much rent have I paid for the eggs?
I don't know. The costs are going down as
They are going down, but
The costs are going down.
What are the costs actually?
The costs are very high. The woman I know who did IVF, and I will not mention her name.
Yes.
Let me tell you the story. So the woman, the one I was telling you, came back, met Dr. Nore. Dr. Nore is well trained in the US, so he's a very good embryologist. I said I will not mention names today, but I have. So yeah, she went. So this is a very renowned doctor who has had a very high success rate. And did her IVF rounds, took 6 weeks, matured her follicles, went locally to harvest in this particular clinic. Let me not say where it is. So when she harvested, she got 15 eggs, which was a good success.
15 eggs is 15 babies.
Yes, if they are all
because
viable.
when you're talking about 15 sperms, there might not be a baby there.
No, now when they're doing insemination, of course they isolate the best gene. That's why IVF babies are very bright, because it's only the best egg and the best sperm that make it outside the lab.
How do you get the best one? By looking at them.
They use the lab. They use their own analysis. I'm not exposed to that.
The protein in it?
Yes, I don't know how they look. The viability, I don't know.
Okay.
But now this particular viable eggs.
It's interesting that you said healthy. It's interesting you said bright, but not healthy.
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 Yes.
That sounds better.
Yes, healthy. Healthy sounds better.
Yeah.
So they harvested 15, made, was it 5 embryos? Because remember I told you. Yeah. They've made it in the lab. So the man also donates the sperm. Then the eggs are made into embryos. And the embryos have a higher chance of surviving than the eggs alone. So then these particular embryos were inseminated back into her. And then you are advised to lie.
5 of them?
Yes. Because now I told you.
5?
Every woman has a 25% chance of getting pregnant.
Okay.
So then if they put 4 eggs in you, you might get 2, which is twins. You might get 1, you might get 0. So they must increase the probability of you getting an egg to attach to your womb.
When an embryo is made in a lab and thrown into your womb, it attaches.
Mostly yes. That's what IVF is. Because even for a surrogate,
it attaches just by itself.
Yes, but of course you are under a lot of. They give you enough progesterone. They prepare your body to be able to mimic a pregnant woman's body at early stages. So then it's a natural process. Even in surrogates, that's what happens. When you're getting a surrogate to carry your baby, they have to prepare her womb and put your egg in her womb.
They prepare how?
They give her the hormonal injections. So that you see now when you're ovulating, there's an optimal amount of hormone your body goes through. So then they make her have that condition for incubation of the baby.
So the moment you get pregnant, there is radical hormonal changes that happen to your body.
Radical.
So they radicalize you then.
Yes.
Before they put a baby into you.
Yes.
And
then now still that is.
Did you tell me the prices of
I'm getting there.
Of egg warehousing?
I'm getting there.
Okay.
I will tell you the price of IVF before egg warehousing.
Okay.
So this particular woman then was told to lie on her back, mostly with legs up, sometimes without, but always lie on her back for 2 weeks. And not go outside, not go anywhere, minimal movement, so that the embryo can attach. Because then you can even go to the bathroom and it comes out, right? So it's a very, very high-risk procedure. So unfortunately, in her case, she did 2 rounds and they both failed. Round 1 for eggs, round 2 for eggs.
5 of them. 5 failed.
I think 4. I don't know how many. Can I just have erroneous numbers for the sake of this conversation?
Yeah, but we are seeing more than 1.
Yeah, more than 1. It cannot even be 2.
And they failed?
Yes.
And then she went back for the second round?
Yes.
And?
Now again, the whole cycle failed again. And one IVF round, according to that time, what she was charged is 500,000 Kenya shillings. That's
so she threw $1 million out of the window.
That's around $4,000. But the baby is priceless. And remember, the societal pressure to get a baby
You think a baby is priceless?
Yes. A baby is expensive, but having the baby cannot be quantified to money.
This is a moot point, but I'm just wondering, some people go somewhere to have a good time in the back of a car and boom, pregnant. And here you are spending 500,000 and another 500,000 and nothing comes out. Did she go for the third round?
No, I think after that she was given because also your body has to rest. Remember, during that time of hormonal pumping into your system, you're you are saturated with hormones. So of course you have anxiety, you have depression, it comes with so many other adverse
You're
symptoms.
feeling really bad about life.
Yes. And then now you become discouraged. Round 1 fails, round 2 fails. So she was told to also give her body a break and take a break. So she was given, she had now to go to the bank and store the rest.
She had 15.
Yes.
She stored the rest. 5.
I don't know the number that she stored, but I know her babies are somewhere in a bank.
Up to today?
Yeah. So now you get a surrogate who's a younger woman, or a woman who has been pregnant before, who has a higher chance of picking the embryo.
Okay, so that's what you're saying, that perhaps now her best option is to do surrogacy.
Yes. And that's a journey of at least 1 out of 10 women in the world.
What do you mean?
I mean, some women now who want to get pregnant and the PCOS has led them into an infertile window, or is not well managed. So then they have to go through that. And there are many stories, many stories.
Yeah, I remember my sister going through it. I think hers failed twice, and then the third one she got triplets.
IVF.
Yeah. She got triplets. Now they are 1 year, and the other day she was really dancing on TikTok when they were taken to the kindergarten for the first time. Is it a kindergarten or a nursery? There is
preschool. Let's just call it preschool.
Yeah. She was really dancing, but she can now.
God bless her. She's lucky. She's very lucky. You know, children come from God, yes, but also God created doctors.
Yeah, but I think also something happened that the doctor did not tell them about. Something happened. I don't know. I remember her telling me that story, but I don't know. But the doctors gave some explanation that was that they were content with. Something happened about the eggs. I don't remember the story properly.
They died?
No, I think what came out did not match the explanation of the doctor. No, in terms of sexes.
Yeah. Oh, okay. Okay.
You understand what might have happened?
I see it.
Yeah.
It's a privilege, honestly, and she's lucky to even have a husband who was understanding enough to go through the process.
And interestingly, they could not afford it in Europe. They had to come to Kenya to afford it here. Yeah.
So you're saying Kenya is cheaper?
I think much, much cheaper.
I don't know why I thought the reverse is true.
No, they couldn't afford it in Norway. I think that's what she told me, that was very expensive in Norway. Too expensive. I think in Norway it was going to cost them like 5 million, but in Kenya it costed them about 1.5.
The 3 rounds, yeah.
Yeah.
So you see, I was accurate, $500,000 per cycle. Yes. And it's an emotionally draining process.
It is, because I remember at some point my sister was just floating. I mean, taking a plane from Norway together with your husband, coming and staying here for 2 months to try, and then failing.
Then go again.
Yes, and then coming back from Norway and here again and failing. Then my sister was really it was very traumatic for her, because she had undergone a lot of abuse. About, in Luo culture, the idea of not having a baby can be a pain.
Yeah.
Can be a lot of pain.
Especially when you're married.
Yes, a very big.
It can be a gate to polygamy. Not even a door, not even a window, a gate.
And even divorce.
Yes. Nowadays divorce, but in past eras. Polygamy.
Yeah. So then how much is warehousing the egg?
Okay, the egg is not big. I think even this water is too much.
That I don't think they look at it like that. I don't think they look at it like that. Capitalists do not look at the size of stuff.
Yes. They look at it as we're housing a living organism.
Well, let's give it to you, put it in your fridge, we see.
Yeah.
Every
time I come to your podcast, the word fridge must come up.
What did you say about honey and fridge?
Yeah.
So let's ask. Do you know the numbers? How much it costs?
No, but the audience can tell us. Those who've tried to warehouse their eggs or their embryos, they can tell us.
Is it called warehousing?
That's the word you invented, and I like it. Because for me, what I do, like in my data company, I do data warehousing, but we store data on cloud. So it's very interesting to see egg warehousing. But I like the word warehousing.
Yeah. How much does it cost to save your egg in a bank?
But I know it's as low as...
In a what bank? In an egg bank. Let's try egg banks.
Yes, because I know of sperm bank. I don't know about egg bank. I don't know. Or embryo
sperm
bank.
Bank is completely a different reason. See, those are just men who are
for
selling. For
donations.
The men who are selling. Yeah. Ho! I told you, if you don't want to go to a fridge, I'm telling you.
How much?
Per cycle, which I don't know what that means.
A cycle of IVF.
It is 8,000. That is 1 million Kenya shillings, and 20,000, depending on the clinic and the region.
No, that is IVF process. I don't think that's egg warehousing.
Cost of egg freezing procedure.
Yes.
Yes. They have to freeze them.
Meaning harvesting and freezing.
Yes.
Yes. Procedure means from harvesting to freezing. Now, those ones who have frozen, how do you, before you decide to do the IUI or IVF, how long does it take? Like, how much do you pay for the egg to stay in the fridge?
Storage fees is $1,000 per year.
Yes.
100,000.
That's accurate.
100,000.
Because I know in Kenya, the one who's storing theirs in Kenya pays between 15,000 to 25,000
per
month. The reason why I don't want to say, the reason why I do not want to say the price is because someone can quote and say, but I had this much, so I don't know the price trend. So let me give a range.
20,000 per month.
15,000 to 25,000 per month, and it's a very small space. It's a very small space it occupies.
You are the mathematician. If it is 15,000 times 12, that is how much?
180.
That's how fast you are in maths.
I don't know. I don't know if I'm right. Check.
What was it?
15 times 12.
What is 15 times 12? 180. Wow. You're that good in maths?
Yeah, I'm a straight A student in math.
Ooh.
If I study, it's not top of mind.
That's why a man somewhere I know is always saying she's very bright. It was really nice having you here.
Yes.
That was 1 hour, 20 minutes of talking about freezing eggs, talking about PCOS.
Yeah. Thank you for having me.
Yeah.
This is a topic that we can even have a series on because PCOS is a very complex.
If you want to go for a
disease.
checkup, where do you stop? Where do you start?
Your doctor will be an OBGYN. OBGYN. Doctors who are OBGYNs.
What is that?
Obstetrics and gynecologists. Obstetricians. That word
What, do they have to Okay. Anyway, thank you very much, people of the internet. It's always very, very nice having you here at Dialogues with Jagero. We crossed the 100,000 subscribers mark. And after that, I think that happened about a week ago. And we have added about 10,000 subscribers after that. So we are doing really, really well, thanks to beautiful and resourceful guests like Okwisa Okwayo. You know, you are double O.
You want to dub me that?
Yes, double.
Thank you for having me.
All right.
I appreciate it.
Until another episode, bye for now.